Coffee's outside to the right. It's really great to be here. It's great to see everyone. This is a special meeting. This is not a typical scientific meeting. I think that just in the last hour of just quick conversations with people, it's really an impressive group, and I think this is the group that will allow us to be productive and meet our goals, which will unfold in the course of the next 2 days. Now, the reason we're here is really started with Chester Pierce. For most of you have not met Dr. Pierce, but he was just one of those people, like special, like can't be reproduced in any shape or form. He seemed to be able to understand what's coming decades before it happens, and his vision around international psychiatry or global mental health preceded anything that we're doing now. It was, he was talking about this in the 1970s and how important it is for international collaboration and so on. But back in 2002, Dr. Pierce held a meeting in Boston at Mass General Hospital, a week-long meeting, and he brought in Black psychiatrists from all over the world. He went out. He got funding to do it. He was never a big fundraiser type guy, but he felt so strongly about putting together this meeting that he went out of his comfort zone and went out and raised funds to do this conference. And it was a remarkable thing. There may be a few people who were at the meeting, at that meeting. I was there, but I was there only as a witness. And to take notes. I was a note taker. But the meeting was absolutely amazing, and it really set the tone, and the message has carried through to today. But the meeting was originally to bring people together to talk about what are the challenges that each group or country faces in caring for Black patients around mental health. Like what were the challenges? What were the successes? What were the failures? What were lessons learned, and so on. And it was interesting because the meeting, each presenter talked about their country and the state of mental health care in their country. And there was two major observations. First is that there's a tremendous amount of similarities across countries, and there's a tremendous amount of differences across countries. Like each country, the person representing the country, they were at various levels of having capacity to care for people with mental illness in their countries. And it was clear that some countries were way ahead of others, and some countries basically had no or very little mental health care. And so at the conclusion of the meeting, the group had decided that it was important there were a bunch of things that actually could happen, but one of them was kind of a longer term vision of there needs to be an organization that allows and fosters collaboration across countries so that things can move forward at a more rapid rate. And so from that meeting, there was very nice proceedings that was published, and but at the time, so again, this is back in 2002, right? So at the time, people were talking about this, but no one really had the capacity to move forward with initiatives like this. There were, starting to be, spot collaborations, one project here, that sort of stuff, but nothing in a systematic way. And of course, there were no resources because both what we deal with in the United States and then in pretty much every country, um, mental health resources for mental health care and systems are, at the bottom of the list when it comes to healthcare priorities, and that's the majority of countries around the world. So it's hard to make things happen when you're fighting for a dollar, you know. So it's really difficult, and it has made this progress in mental health, very challenging. And again, that's a global issue. But that being said, we, really, there have been a bunch of initiatives, including through NIMH and things spearheaded by Pamela Collins, and putting together these global mental health research hubs. Organizations like the Grand Challenges, the Welcome Trust, and others started to really buy into the need to support mental health research, at least in the beginning. Um, the World Bank has started to pay attention. So there's been a significant amount of projects, and if you fast forward now to today, looking over really the last 20 years, that the progress has actually been pretty tremendous. I think with some of these collaborations. So we, as a result of that, we held the second um, diaspora meeting, African diaspora meeting here in Cape Town in this facility in 2016. I think the idea of that was born at a bar in Cape Town with Bonga, myself, and Tala, and a few people. The beer was really good, and it turns out that the WPA was having their international meeting in Cape Town, and we thought, oh, here's the perfect opportunity to piggyback on that meeting. And we were able to raise some funds, and we held the meeting. And the meeting, again, just fantastic meeting. Many of you were here, although we do have new faces. And it became clear to us that this is it. Like the time is now. I think collectively, if we were to take all the work and projects that people were doing across countries and the collaborations and stuff, it would really look impressive, in fact. And so the notion that we came away is that we really, now's the time to accelerate the capacity building. Like in psychiatry and mental health, like the good news is that it's not rocket science per se. Like there's no trade secrets. Information is readily available, but it's like how do we leverage the resources of everyone and to allow people to accelerate. Like, if you're starting a residency training program, why would you have to start at the beginning and develop curriculum and all of this stuff and structure, all of this? Why can't you take somebody's package from this country, adapt it to your country, and move forward a lot faster? And that basically was the theme. Like, we need to accelerate the capacity building to be able to provide health care, comprehensive mental health care on the continent and in the diaspora. And so the areas of focus were research, clinical care and services, education, and policy and advocacy. And so with those four pillars, we were charged with, okay, let's start to make this happen. And from that, we decided that there really, in order to organize all of this and to foster the sharing of resources, that there really needs to be an organization that does that. That's a that allows for this process to move forward. And thanks to Senite, back in Boston, we went through a series of um, discussions with all different types of organizations, and we believe we've arrived on a model which we'll hear during the course of the next 2 days that will allow for this to happen. But really, the charge is that let's do this. We've got like if you look at the if we take the brains of everybody in this room, it's like unbelievable brain power that we have here, and many and most people in this room are here because they get things done. They make things happen. They move forward because it's very easy to have wonderful conversations and then have nothing happen. You can have a wonderful organization, but actually nothing gets done. And so this 2 days is about let's get stuff done. Let's move forward. There's tremendous amount of opportunities. There's tremendous amount of need, but we have resources that we can share, and some of it will be making those available, connecting people to each other, so that we really can accelerate this process. And so we're now at the third African Diaspora Global Mental Health Conference, and we think this one will set the tone and will lead to an annual event, which I think we're already thinking about, and but will also show that we can accelerate this process across at least those four domains, and others may be identified as well. So again, I thank you for coming today. You're here because you're needed, and I look forward to having two very productive days, and then we shall all see the power of working together, and how well it works, and how fast we actually can move forward with the science, and to be able to provide care for people suffering from mental illness. And that's it for me. I'll have Michelle Durham come up. Okay, so thank you.